If you are a man and you have started losing your hair, this video is for you. We are going to cover the most common treatment options for male pattern hair loss, medications, procedures, and everything in between. Male pattern hair loss is the most common cause of hair loss in men, and it can begin early, even in your late teens or early 20s. By the age of 50, more than half of white men have visible signs: a receding hairline, noticeable thinning on the crown, or even a bald spot. So how does male pattern hair loss progress? Generally speaking, it develops slowly. The good news is that treatment options are available. The primary aim of treatment is to reduce further hair loss. Some men actually regrow a bit of their hair. The men who see the best results start treatment soon after noticing the hair loss, not years later, not when it is too late. Now, I am Dr. Elsie Khalifa. Let us get into the options. First, medications. In the USA, the FDA has approved certain medications for male pattern hair loss. These are also available in other countries. The first is topical minoxidil. In the US, you can get it without a prescription. Topical just means you rub it into your scalp. This is one of the most commonly used treatments. In clinical trials, minoxidil has been shown to reduce hair loss, stimulate hair growth, and strengthen existing strands of hair. However, while minoxidil can help, you are unlikely to see full regrowth of your hair. You should always follow the instructions given by your health provider and on the information leaflet. Generally, you apply this medication to your scalp twice a day, every day. How long does it take to see results? Some men respond to minoxidil better than others. Some men fail to see any difference. If minoxidil works for you, it can take 6 to 12 months to see results. Consistency is everything. Like any medication, minoxidil can have side effects. Always read the information leaflet before you start. Some men develop an irritated scalp. The newer foam formulation seems to reduce this risk. Other possible side effects include an itchy scalp and headaches. Many men see results with minoxidil alone. But if you see a dermatologist, they may add a prescription medication to your treatment plan to improve results. When you stop applying minoxidil, you generally lose its benefits. Minoxidil helps you maintain your hair's thickness. Some hairs may look and feel thinner. You will also gradually notice more shedding once you stop. The second common medication is finasteride. This is a prescription medication. You need to see your health provider, who will prescribe it and weigh up whether it is suitable for you. Finasteride has been shown to slow down further hair loss in about 80 to 90% of men taking it. Some men may also see some hair regrowth, which tends to occur in men who start finasteride when they first notice signs of hair loss. Generally, taking finasteride involves taking one pill every day. If finasteride helps you, you will generally start to see results in about 6 months. Again, like any medication, there are side effects to be aware of. It is important that we cover these. They include decreased sex drive, the inability to get or keep an erection, swelling and tenderness of the breast area, and in some cases, depression. It has also been reported that sexual side effects can continue after the patient stops taking finasteride. Due to the seriousness of these side effects, you need to have a detailed discussion with your doctor before they prescribe this medication. To maintain results, you must continue taking one pill every day. Once you stop taking finasteride, hair loss generally returns. You should weigh this up with your doctor and discuss the benefits as well as the risks. Now, moving away from medications, there are other potential options. Some affected individuals find wigs, toupees, and even hair extensions very helpful in disguising hair loss. Synthetic wigs and hair pieces like a toupee usually last about 6 to 9 months. They are easy to wash and maintain, but they can be susceptible to heat damage and may be hot to wear. Real hair wigs or hair pieces can look more natural, can be styled with low heat, and are cooler to wear. Another option is skin camouflage. Spray preparations containing small pigmented fibers are available online and may help disguise the condition. However, these preparations are likely to wash away if the hair gets wet. Rain, swimming, or heavy sweating can ruin the effect. Surgical treatment is another route. Hair transplantation is a procedure where hair follicles are taken from the back and sides of the scalp and transplanted onto the bald areas. This is the most common surgical option. Another option is scalp reduction, where a section of the bald area is removed and the hair-bearing scalp is stretched to cover the gap. These procedures are typically done privately. In the USA, several laser devices are now available to treat hair loss at home. The FDA has cleared some of these. If you see FDA cleared on the packaging, this means the FDA recognizes the laser as a safe treatment. But whether or not they work depends on the individual using them. It is also important to remember that the requirements for getting FDA cleared are much less stringent than for getting FDA approved. This subtle wording difference is one you should be aware of. There is also something called platelet-rich plasma, or PRP. PRP involves drawing your own blood, processing it to concentrate the platelets, and injecting it back into your scalp. PRP is not a permanent solution, but maintenance treatments can help you maintain results. I mention it so that you are aware of it and can do your own research. Let me summarize the key points for you. Start treatment early for the best results. Minoxidil is available over the counter and can be effective, but you must use it consistently. Finasteride is more effective at stopping hair loss, but comes with more serious potential side effects. Non-medication options like wigs, fibers, and camouflage can help disguise hair loss. Surgical options like hair transplantation are permanent but expensive and invasive. Laser devices and PRP are newer options with varying evidence. One more thing. If you are considering any of these treatments, talk to a board-certified dermatologist. Not a general practitioner. Not an online influencer. A real doctor who can examine your scalp, take a full history, and guide you to the right treatment for your specific situation. Male pattern hair loss is not a death sentence for your hair. There are options. But the sooner you act, the better your chances. I am Dr. Elsie Khalifa. If you learned something today, hit like and subscribe for more unfiltered medical truth. Share this video with a man who is losing his hair and does not know what to do. He needs to see this. And comment below. Have you tried any of these treatments? Minoxidil? Finasteride? A hair transplant? What was your experience? I read every single comment. See you in the next video.